The fourth point and last point is that physicians want to use this information. There's been many surveys. Would you use genetics to prescribe drugs if you could? Are you interested? Yes, yes, yes. What's the problem? We don't have guidelines. We don't feel like we're educated. This is a new thing. We need help.
Since the introduction of pharmacogenomics, the provider now has the ability to appropriately prescribe medications based upon an individual's genes. No more trial and error or second guessing. But there have been some challenges in using this important breakthrough. The biggest challenge has been on how to interpret the test report. Often there are many pages sometimes associated with this report that can be confusing, and providers have asked for help. As they say, ask and you shall receive. We are proud to share with you a short overview of an amazing software solution empowering you with the ability to take advantage of pharmacogenomics testing with ease. Let's take a look, shall we? The first thing you're going to do is go ahead and put into the browser this particular address, hit enter. That's going to bring you up to this screen right here. Then you're going to enter the patient ID, the specimen ID, and the patient DOB based off the report itself. Here's an example of the patient's report. You're going to be looking for the patient ID here on the first page, their date of birth, and then scroll down to the bottom of the first page and you'll see something that's called specimen ID number. These are the only three things that you're going to need to get into and actually look at this report live online. So we go right in here, put the patient ID in, and then the specimen ID, and then the patient's date of birth. And then hit login and it'll open it up. This is your initial dashboard when it first opens up. You want to go here, just hey, agree. Once the test is completed at the lab, it simultaneously creates a hard copy report and also ports into this interactive live software. Here's your main dashboard with quick reference tabs right here. Along the sides, it also gives you areas in which you can go to specific risk factors. Here's where it talks about the regimen score. The lower the better, the higher the worst, and the current medications list that that particular patient is on. Let's go ahead and scroll back to the top, and let's take a look at the pharmacogenomics report, shall we? Here's the pharmacogenomics report and what it looks like. Basically on page 1, you have the patient information, provider information, aspects about when the specimen was submitted and collected, a table of contents of what's in the 21 pages that happens to be in this particular report. Again, highlights, you'll recognize this on the cloud-based platform. Next, you have the current medication report. These are in higher risk, yet they're also in higher benefit. These are in lower risk and in higher benefit. And then each one of these particular drugs have a rating scale. The lower, the better. The higher, the worst. As you can see, as a whole, this is relatively lower as far as how harsh the medication will be on these particular patients. Next, it'll go into current medication summary of each particular medication and certain risk factors. And then as we scroll our way down, it'll list all the current drugs that have been completed through pharmacology with the FDA and list them on standard precautions, which means based on the genes here. Any of these medications is fine for a patient. This is caution information, and here's where you should consider alternatives. Here we have a genetic summary, the genes tested that deal with metabolism, the alleles relative to potential mutations of the gene, the particular genotype. Then you have phenotype. Each gene is given an aspect of defined metabolism. Listed down here, PM for poor metabolizer, IM for intermediate metabolizer, EM/IM for reduced metabolizer, EM for extensive metabolizer, RM for rapid metabolizer, and UM for ultra metabolizer. And it basically lets you know whether the metabolism of this particular gene is going to influence the way the drug is actually utilized within the person's body. And at the very end, there's a card that the patient will cut out and can keep in their wallet, so if they're anywhere in the world, it will be able to help them out. Make sure in the notes section to add the web address, the patient ID, the specimen ID, and the date of birth, because this information is what the other providers are going to use to be able to go in and access their pharmacogenomics report live. Something like this right here will be fine. Okay, let's get out of this and go back to the beginning. Now, to me, one of the most interesting tabs here is the Update Medications tab. So let's click there. What you're going to see right here is a quick overview of the current medications that the patient currently has. Let's say, as a prescriber, you're wanting to add some type of a medication. You're going to click right here. Let's say we want to add aspirin. Just put the first couple of letters, and we're going to go ahead and we're going to add this. In real time, what it's going to do is it's going to search the database, look at it on how it's going to be relative to the efficacy of the overall medications, and then give you some ideas of things that you should look at. In this particular case, it talks about if somebody has taken Plavix, that there's likely going to be an issue if you're prescribing aspirin for this patient. Now, this patient is currently taking Plavix, and right now it's in the bottom right quadrant. Let's see what happens if we were to add this drug. This drug went from being lower risk, higher benefit, to higher risk, lower benefit by adding aspirin. So not only does it give you real time if the medication would be good or not, but it'll also change the overall efficacy of any medication that you may currently want to prescribe your patient. One last thing before we leave here. Under this search medications, to give you an idea how powerful this tool is it lists every single brand name and generic medication that's out there. And this database is updated twice a day for any new medications that may come to the forefront. And it's also pinged to the database at the FDA for pharmacology, any drug that's completed pharmacology, and if there is in fact any black label warnings that would then obviously make issues relative to the overall efficacy. Just like what happened when we added aspirin to the whole equation here, and we brought Plavix from here to a higher risk with a lower benefit because we added the aspirin and lowered the efficacy of the entire platform. So unlike the old way of just looking at the report and trying to figure out what to do, in real time you can add or delete or move or replace any medications you want, and in advance know how well it's going to work prior to prescribing, so you can see how powerful this tool is. Now let's go ahead and scroll to the top of this, please. You also notice that it changed the overall alert score from 15 to 22. Now let's go back to the main dashboard. Okay, now that we're at the main dashboard, let's talk about something that's very important as well. How many of you out there have patients that actually see other providers? Probably most of you. So this is where it gets really exciting. The patient can share this entire information with every single other provider in the entire world. All the patient needs to do is give the doctor the patient ID, the date of birth, and the last specimen ID, and the new provider can go in and look at the pharmacogenomics test just like you can. And if they decide they're going to make any types of medication changes or adjustments to the protocol, one, they can make sure the efficacy would be appropriate, And two, you will be able to see the last provider who was actually in there and might have made adjustments to the fantastic medication protocol that you originally put together with the patient. This automatically happens because the software saves the last changes, and that now becomes the most recent report. Go ahead and be on the cutting edge for you and your patient.